I'm Dr. Tom Rogers. I've been doing family practice for 27 years. As a family doctor, of course, we treat a lot of sinus infections, a lot of chronic sinusitis, especially in this area of the country. I used to use a lot of oral antibiotics like everybody else, and I found custom compounding. Found out that they could compound medication individually that you can put locally inside the nasal cavity where the infection is. I like it because you don't have to give oral medications that have systemic effects on your stomach. You don't need to hit an infection everywhere in your body, just your sinuses. They're able to customize it with an antifungal, an antibiotic, tailored to what bacteria we come up with, and also sometimes a corticosteroid that they need for inflammation. I found it to be tremendously useful in my practice. Use it all the time. I'm a huge fan of it. It works great.
I'm Dr. Hal Lovelace. I'm an ear, nose, and throat doctor with Holston Medical Group. One of the things that we see a lot of is sinus and allergy disease. And as the years have gone by, the treatment has changed a little bit. We have some new tools that in many cases work better, and in many cases work with fewer side effects, less complication, less risk. One of those things is using compounded solutions for nasal and sinus problems. Now we can actually add the steroid to a compounded solution used to treat sinus and allergy problems, and instead of taking separate antibiotics, separate oral steroids, or steroid nose sprays, they can all be put into one. Then a few years ago, there was some research that indicated there might be certain patients with chronic sinusitis that had a fungal component to it. Either fungal infections or allergies to funguses that were just existing inside the sinuses. So we started using fungal medications. One of the big problems with taking oral fungal medications is that sometimes they're hard on the body, especially the liver. And again, when you take any medication by mouth, your entire body is subjected to those drugs, not just the area that you want to treat. So now with the compounded solutions, which are sort of sweeping the ENT world, we have a new tool to treat.
My name is Stephanie Roach. I'm a family nurse practitioner at Centerpoint Medical Clinic. We have lots of patients this time of year with chronic sinus problems and mono. I've had some recent patients with mono who have kept getting sinus infections, and we've treated them several times with oral antibiotics. The only thing that has seemed to clear up those sinus infections is the sinus spray.
This is what we use. We take the top off, you squirt it up your nose on both sides a couple times a day, sometimes more. Very easy to use. You're getting the medication to where it needs to go.
One of the nice things that we have available here is custom making the solutions for that particular patient.
My patients that I have used custom compounding sinus solutions have came back and told me that this really works for them. Completely clears up their sinus problems.
One of the things that I'd really like to recommend to patients or emphasize, if they're having a sinus problem, don't just try to deal with it yourself. Don't take over-the-counter medicines. You're not really sure what you're dealing with. And I would highly recommend that you see a professional like an ENT doctor or talk to your pharmacist about what might be available to treat these.